Some of the problems that we see within Penda are difficulty with access, of course, long wait times, and then quality being a big issue with low guideline adherence. Cost is a big issue. We think that only maybe about 5 to 10% of people are insured, and quality care, if you're not insured, may cost like 5 to 10,000 shillings for a visit. Of course, all inclusive. That's consultation, lab, medicines, again, for the outpatient setting. And low trust. So one of the things we find when we speak with patients is that almost 60% of patients say they wouldn't want to return to the last clinic they visited. And the Net Promoter Score for healthcare, which is that question you may have gotten before where someone says, how likely are you to recommend this place to a family or friend, 1 to 10? The Net Promoter Score for healthcare in general is only about 10 or 20%. In general, people don't tend to have very good experiences in healthcare. Our model at Penda, some of you may have heard of Penda or even seen some of our branches. We have 16 outpatient facilities. Those are level 3B facilities, which are open 24 hours a day, 7 days a week. And then we also have telemedicine all across the country. And the thing about Penda's model is we're super patient-centered. We have clinical officers, laboratory, pharmacy, and that allows us to give affordable and comprehensive care to children, adolescents, adults, and even older adults. And then we've also started investing more in AI-powered quality systems, and that's what allows us to deliver a more consistent and also scalable experience. I wanted to take one moment just to talk about our partnership with HUCAS. We've been collaborating now for more than 5 years, and we have had several trainings for Penda's lab techs, including biosafety as well as biosecurity. And then we also are part of the EQA program for many of our common tests. So I just wanted to thank you guys for that partnership, which has been very fruitful for Penda. Now, coming into the AI aspect, you've probably seen a lot of these different headlines over the last year or so. So, AI chatbots being better than doctors at diagnosing illness, diagnosing complex health conditions. And then this other one just came out just in the last couple of weeks that Kenyans topped the global rankings for ChatGPT use. I don't know if you saw that. 42% of Kenyans use ChatGPT every month, which is higher than any other country on earth, right? In terms of the percentage of people who use it. So obviously we've long been, early adopters of technology, but we're really seeing that with AI. So it's there, it's out there. Probably if I asked you all to raise your hands if you've used it, I would guess that almost everybody in this room has used it. So we know it's here, and I think what's really exciting is how can we start making it, work for us to improve the quality of services that we receive. Within Penda, in a typical clinical visit, we have identified 4 key decision-making moments. So these are times that the doctor, the nurse, the clinical officer needs to make decisions about something. So the first one is when you're taking your history and doing your physical exam. What questions do you need to ask? What physical exam things do we need to do? Those are decisions that the doctor needs to make. Next, we get to appropriate testing, which is obviously like most relevant for this conference. Did we order the right tests? Are we forgetting some tests? Are some of the tests we ordered maybe misleading and we actually shouldn't be doing them? And I'll give you an example of that. Diagnostic accuracy, obviously, once we record the diagnosis, is that diagnosis right? Are we missing some diagnoses that should also be there? And then finally, the guideline-based treatment. So given everything that went before, given the diagnoses that we've made, are we providing the correct guideline-based treatment for the patient? The way we've decided to implement this is using what we call a traffic light system. So we ask the AI model, so like a ChatGPT, for example, to review the documentation that we've done and then give us a red, yellow, green for whether there's a problem. Red is like there's a serious problem. And when we get a red, we need to give an intrusive pop-up to the clinician so that they really see it and consider whether they should make a different choice. A yellow means like maybe it could be better, but probably the problem isn't life-threatening or maybe it's debatable. And that shows the clinician a small little yellow alert bell. And then if everything looks good, the clinician just sees a green tick mark. The reason we decided to go with this approach is we know that clinicians are busy. Clinicians don't have time to constantly be looking at pop-ups, reading text. We need to try to minimize the alert fatigue for all healthcare staff who are going through their typical workflows. And so we only want to make those pop-ups when the model detects that there could be a serious problem. Now, for all of you techies in the room, I wanted to take just one slide to kind of explain how it works technically. The trigger for this happening is what's called a focus out event. And so an example would be once a doctor puts in their diagnosis and then they leave that area of the electronic record, that tells the system to make a call in the background without the clinician needing to do it to the model. What does it ask the model? It starts by saying you're an advanced clinical decision support system supporting clinical officers in an urgent care setting in Nairobi. And then we give some examples for what red, yellow, green looks like, and then we tell it what kind of output we want. Then we give the user prompt, which is de-identified text-based clinical data. So what does that mean? Obviously, I don't want to send to ChatGPT that, Leonard here is my patient with phone number 07 ... No, we don't need to send any of that identifying information. We just need to say, this is a 30-year-old man who has a headache for 2 days, here are the vital signs, et cetera, et cetera. So nothing identifying of the person to go into that user prompt. And then what we want back is we want the severity, the reason, and the action that the clinician can take. So the easiest way to understand this is for me to show you an example. And I don't know if you are able to really see this, so I'll have to voice over it. But one of the common problems we see is this patient that I'm going to give you an example. A 27-year-old woman who has white vaginal discharge is her chief complaint. It's been going on for 2 days, thick and curdy, not foul smelling, a bit itchy and uncomfortable, and there's no pain with urination, so no dysuria, okay? And she took antibiotics for a homa last week, all right? So I think many of you are thinking, probably this could be a yeast infection, isn't it? But one of the common errors that we see made in our setting is that clinicians order a urine test. Something going on down there, let's get a urine test, okay? And then urine tests, as you know, often have some kind of abnormality. Maybe it's some WBCs, maybe it's leukosterase. And so it's really not the right test to order. So let me kind of show you what this looks like. Hopefully you can see it on the screen. The vital signs are there, the chief complaint is there, the history is there, and now as a clinician, I'm going to my investigation ordering, I'm typing in urine analysis, I select it. As soon as I click out of this box, you see that little blue, that means that the model call is being made, and then it's returned a yellow. And let me pause this so you can read it. Okay, maybe you can't read that. What it says is the urine analysis is not directly related to the primary complaint of white vaginal discharge, which is likely candidiasis given the description. Action, consider ordering a high vaginal swab or KOH prep and discontinue the urine analysis. Good advice, right? So now the clinician can decide what they want to do. They need to acknowledge it, but then they can decide. They can keep doing the urine analysis if they want, or they can say, let me remove the urine analysis, let me add an HVS, and then when they again click out of this after ordering the HVS, the model runs again, and what you're going to see here at the end is it returns a little green tick. Can you see that little green tick up at the top? So the clinician doesn't need to go through and read anything else. They can just see, okay, I got a green tick, everything looks good, let me move to my next thing. Does that example resonate as probably something you've seen where a lab test is ordered that you know like might not be the right lab test for the patient? Does that happen? It happens, right? We see it with H. pylori a lot. You know, someone has 1 day of maybe loose stools, and we order H. pylori. That's not how H. pylori presents. But yet H. pylori is common, and so it may give a positive result, and now the patient's going to get a treatment for something that isn't really the underlying diagnosis. We see it with typhoid, we see it with many different examples. So I think getting the right tests to be ordered is very, very important. Okay, so what has the impact of this been? What you're seeing here is the number of visits at Penda that have a red at the end of the visit, okay? And we had two groups. We had half of our clinicians that had this AI system turned on, and half of them without the AI system turned on. And what we saw, the yellow line there, is the ones that had it turned on. And that means that they're driving down the number of reds at the end. Because if they act on a red, and then the model runs again, and now it becomes a green or a yellow, that problem has been averted, okay? And so what we saw is that over time, the clinicians that had the AI turned on had much fewer errors, according to the model. But now, did it result in better care? And this is part of the kind of big publication that we released in July, which you can look up online. The whole thing is there, and it's just freely available. We had over 100 different expert physicians score for errors. They looked into the medical records, and they said, is there an error in the history? Like it's missing something key. Is there an error in the tests ordered? Is there an error in the diagnosis? Is there an error in the treatment plan? And what we found is across all of those different categories, errors were quite significantly reduced when there was this AI safety net for clinicians. So I think it was one of the most important kind of first real world studies that AI, when deployed as a safety net to help support clinicians, we can actually reduce errors on a pretty big scale. So looking at Penda, with this system, we expect it would reduce over 20,000 errors per year. So it's not insignificant because, as you know, errors are common. We have a couple of rigorous evaluations underway. We have a large prospective randomized controlled trial in collaboration with PATH and University of Birmingham that has already enrolled 10,000 patients, and we expect results in October. And I want to end by talking about a couple of key takeaways. First of all, AI model performance is strong, but implementation is really the barrier. So we've seen how the models are actually really smart, and they're quite good in health. So my call to action to all of you who are leaders in your various health systems is we need to work towards digitizing care and doing these small studies of how can we bring this in and how can we have it help improve the quality of service that we deliver. The next is that clinician adoption and change management is really key. Just dropping the technology in doesn't really do anything. You really need to walk with people and walk with all of the teams who use the technology. We've used peer champions, individualized feedback, and kind of building buy-in as some of our key tools for driving adoption. And then at Penda, we believe that clinicians of the future really need to blend empathy and tool use. So one of the things we say is human at heart, but tech in hand. Right? So what really matters to patients, obviously, is that human empathetic connection. In terms of what's next for Penda, one of the things we're excited about learning more about is what's called ambient scribes. You may have heard of those. It's essentially the idea of like kind of, you know how we have these meeting summarizers, right? The AI note takers that listen to meetings and they summarize them. We have that also for healthcare, and in many other markets around the world, those are being picked up very rapidly because they improve the patient experience. The clinician, instead of sitting at the computer and typing, the clinician can really focus on talking to the patient and building that connection, and the note-taking can be done automatically. So there's obviously questions about patient privacy and confidentiality and ensuring that patients understand that that conversation is being listened to and consent is required for that. But I think that could be a very interesting thing to explore. We need to keep investing in onboarding and training staff to be excellent at using these tools. And then we're also interested in improving the transparency for patients, so making sure that they have better and faster access to their results and records in really patient-friendly ways. I want to end by just talking about patient-centeredness is foundational. As much as all of this technology is really cool and really exciting, I've never once received a patient feedback that says, like, wow, we really love the AI that you guys use at Penda. The things that people say are, you know, the doctari attended to us well, the kids enjoy playing with the balloons, great customer service, kind treatment, quick service. Those are the things that matter to patients, and those are the things that need to be like top of mind for all of us in the context of care delivery. So with that, let me end. My contact is there in case anyone would like to connect with me. And I'd love to hear from you. I'd love to hear any questions and comments and your takeaways after hearing this presentation. Thank you.